At KIMS Cuddles Pediatric Intensive Care Unit, we believe that every child should receive personalized and comprehensive care, specifically in kids with organ failure. Where organ takes time to recover, we need to buy time for their complete recovery. We have established highly equipped Extra-Corporeal Unit at KIMS Cuddles Pediatric Intensive Care Unit, which have provided this support to these very sick kids with cardiorespiratory failure with excellent outcomes. Initiating and managing kids on ECMO needs expertise and highly trained multidisciplinary team. At KIMS Cuddles, we have all expertise and resources available under one roof. And at the end, it's all about team effort. We have expertise in both veno-venous and veno-arterial ECMO support. With the resources and expertise available in-house, we have the lowest downtime for initiation of ECMO in our unit. Being a high-end support, it requires sophisticated equipments which includes different ventilators, high-frequency oscillatory ventilator, inhaled nitric oxide, sometimes bedside ultrasound machine, ACT machine, and a bronchoscope to have a best possible outcome in this patient. We were also able to extend our ECMO support to extremely critical kids undergoing cardiopulmonary resuscitation called as eCPR.
Infection control and prevention is extremely important for the best possible outcomes in these children on ECMO support. This includes isolation rooms, surgical precautions, trained nursing care, and strict infection control policies to keep these kids free of infections. To initiate and continue ECMO support, we have 24/7 cardiothoracic vascular surgeon, ECMO trained pediatric intensivist, and ECMO perfusionist support. Intensivist, perfusionist, and ECMO trained nurses monitor these children round the clock to avoid any complications and to have best possible outcomes. After initiation, these children need comprehensive ongoing care. This comprehensive care includes multiple specialties like pulmonology, cardiology, neurology, nephrology, dietetics, and physiotherapy. These children are at very high risk of secondary infections and pressure sores, and hence nursing care is one of the key components for good outcome in these children with ECMO. These kids need frequent neurological assessment, so wake-up trial become integral part of their assessment. Position change of these children is important for prevention of pressure sores and better and early recovery of lung.
Transporting kids on ECMO is a Herculean task, and over the time we have developed expertise in transporting these kids inside and outside the hospital on ECMO. We have expertise in performing invasive procedures while on ECMO like chest tube insertions, central line, PICC line insertion, flexible bronchoscopy and tracheostomy.
Some of these kids on ECMO requires renal replacement therapy, and we are able to extend our ECMO and CRRT support even in newborns.
We believe in patient and family-centric care, so we regularly promote parents to be at the bedside when the child is on ECMO. Daily, fair and realistic communication with the families of patients on ECMO improves the trust and relieves the anxiety of parents. Being a high-end invasive therapy, we are able to provide this therapy to our patients in a very affordable manner. And at the end, what matters are the smiling faces of these critically sick ECMO patients when they are ready to go home. We are proud to say that our ECMO outcomes are comparable to the Western worlds. So remember, when lung and heart fails, it needs time to recover. And here at KIMS Cuddles Pediatric Intensive Care Unit, we can buy time with ECMO and definitely in affordable manner.